Ebeye Community Health Center is it's the only hospital here in Ebeye that provides healthcare services in the Kwajalein Atoll of the Republic of the Marshall Islands. RMI is a sovereign nation that signed a compact of free association with the US. Ebeye Community Health Center was established in 1986. It is a collaboration between the Ebeye Ministry of Health and Ebeye CHC Board. The main health center is located on the island of Ebeye, while services are also provided through the atoll on the islands of Enibur, Ebeden, and Kujiku. The CHC also operates a school-based health program which serves our schools through the atoll. The mission of the Ebeye Community Health Center is to provide high quality, effective, affordable, culturally competent, and efficient services to the people in the community through the health center program. Our community here in Ebeye, we served around 11,484, and this is population that we're working with right now. It's not only here on Ebeye, but it's also included the other outer islands that we take care of. And as of now, like since the hospital or the community health center is in Ebeye, we're just dealing with Ebeye community most of the time. And as for the other outer islands, there are times, not always, but often we go to the other outer island, and this is the only way we can communicate with them. Otherwise, if there's no fuel or the boat and plane they down, then we cannot reach them. I have two goals with this mini grant that was granted to us: to raise awareness about the link between LTBI and TB diseases, and then to address misperceptions, decrease stigma, and encourage and facilitate testing and treatment for LTBI and TB to the whole community of Ebeye. The outcomes that we expect to get from our goals are this: we will ensure that the community will come to understand that TB is a disease. It's not something to, worry about, that there's no treatment for it, like that we encountered every day of our, every day when we do our DOT, this is what we always hear from them, that TB, they don't believe in the TB. TB is like, it's a curse or something like that. So by doing these goals, we know for sure that our community will come to understand that TB, it's only a disease, and if they get infected, there's also a treatment for that, so that they can be prevented in the future from getting TB. And not only that, but we will allow them to know that they are always welcome to come to the clinic. They might think that TB is like stigma. They don't need to hide themselves, as we understand that there are some people who really understood about this this disease, those that they were educated, those that they work with, like in Quadj, once they get LTBI, the other ones always come forward to the clinic, and they are honest enough that they can take care of themselves, as we all know that we do DOT to all these LTBI and TB disease. We expect that in the future, we don't have to go out to them. But once they understand what LTBI and TB disease is, it's their call to come over to the clinic. They don't have to wait. They don't have to stay there. As we all know that before we come to the program, we hear that there's a lot of, TB cases too, that they die from this because they don't understand. They thought that it's some other kind of curse and, magic, all these thoughts that they really don't understand. As I've been working in the TB program for more than 10 years, and there's still a lot of problems that I see. If we can really concentrate on, then Ebeye or our community will become free from TB in the future. This is what I believe, because since we started this program until now, I still can hear problems that that the childs, our frontliners, that they always go in the field to do the DOT or do contact tracing with contact tracing nurses. They always come back with problems like, oh, these people, they say that they don't have TB, and why are we treating them? Or sometimes they say that, how come that your doctor just treat us like that when we don't have TB? Or some people might don't ever come and park here. Just park your car, maybe how many yards away before you come and, give us our medication, something like that. So I know that this mini grant, we don't want this mini grant to be, we want it to be a great success to our community. We want our community to really know that there are organizations like you that they really need to help, and they are the ones we want to tell them that, to understand that they're so lucky to have these kind of grants that we can extend, or to reach out to them. Unlike other places that they're so unlucky, they just stay home, nothing, no outreach, no awareness, unless they come to the hospital. But us, we have to go out because we have the grants, we have the money, we have the source of income that we can buy our, like fuel or transport or the boat, that we can go out to them. And by doing this, we know for sure that they will get the understanding of what TB, what LTBI is all about. And they will get free treatment, and they will get well with their families.